hypertension and how it affects the overall health?
First of all, I'll tell what is blood pressure. And the pressure exerted on the arterial wall when the heart contracts and relaxes. When the heart contracts, the pressure is called systolic pressure, and the heart relaxes, the pressure is called diastolic pressure. Normally, it should be less than 120 by 80. And if anything above 120 by 80 is called hypertension or high blood pressure. So usually, up to 129, 89, we call it as first degree hypertension, and above 130, 90, it is called second degree hypertension, and above 180 and 120, it is hypertension crisis. Yes.
So my next question to you, doctor, is what is the recommended age to start screening for blood pressure and why?
Actually, when we have started practice about 40 years ago, we used to check the BP only after the age of 50 years, and very rarely for youngsters. Nowadays, because the hypertension is otherwise called disease of civilization, and it is a silent killer. So even youngsters, because of the IT profession and all, and modernized food habits, they are getting the hypertension at the lower age. So it is better to start at the age of 18 itself to screening the patient.
Okay, doctor, you mentioned silent killer. So my next question to you is why is high BP known as silent killer? Is it possible to expect some early manifestation of the disease in youth?
Usually, BP doesn't cause any symptoms. Whenever they come to the clinic for other problems, we check the BP and incidentally you'll find the hypertension. Unless if they're having any other comorbidities or other complication of the hypertension, we don't get any symptoms. Very rarely we get headache, palpitation, breathlessness, and all. And again, that is due to the effect on the heart and all. If it increases the tachycardia, it will also causes the breathlessness. So usually, it is called silent hypertension because it doesn't cause any symptoms as such.
So my next question to you is what is the normal BP range?
Normal anything below 120 systolic and 80 diastolic is normal. And above that it is called hypertension.
Okay, doctor, please viewers take a note of it. And my next and last question to you is what are the tests involved in screening of blood pressure?
Yeah. The first and foremost is recording the blood pressure itself by sphygmomanometer. And whenever we test, you should not start the treatment in the first reading itself because when the patient comes, it is a new environment for him and the BP may go high. It is called white coat effect. So we should not treat the patient. And for that, the home BP monitoring is advisable or ambulatory BP monitoring is advisable. And when constant rising above 140 and 90, then only we have to start the treatment. And below that, we can advise some lifestyle modification like cutting down the salt intake, avoid smoking, drinking, regular physical activities. In simple words, I can say 8 hours sleep is required, 8 hours work, and 8 hours for the other activities, physical activities, and the family and other personal things.
Definitely, doctor. I think all the viewers will take a note of this. With this, thank you so much, doctor, for a very insightful session. I request all the viewers to follow BPIC page for more such insightful videos. Thank you
I
so
want
much, doctor, for letting
yes.
us have you.
In
Yes,
simple words, I can say
yes.
walking first, diet
Okay.
next, regular checkup is must, and your health will be good. Thank you.
That was a wonderful conclusion to our session, I must say. Thank you so much, doctor, and have a nice day.
Thank you. Thank you.